what is your take on the current opioid crisis going on in the United States and many places across the world? Like, why when there's so many other things that seem like they could be good options for pain, why do opioids continue to be the number one thing prescribed for pain, even though it's clear that it causes extreme damage and leads to other, more serious drugs?
I mean,
not like more serious drugs, because prescription painkillers are super serious, just like things like heroin or whatever, where people can't afford prescriptions or their prescription runs out, and then like they go on to street drugs.
Yeah. I mean, like the quick response would be like, there's also this crisis because we do not have like clear better drugs for treating pain. That's one answer. And the second is that, and that's something I try to highlight so far, is that pain is very individual and there's not a one-size-fits-all type of treatment that exists. And that is why people with pain generally tend to go through sometimes 10 different treatments that still don't work, that often are inefficient and lead to severe side effects. And that's what we see, for instance, with opioids, with addiction, respiratory depression. Like, opioids are not a good drug, but the saying that we're using opioids while we have better options is not necessarily true. It might be for some people, and we are working on developing drugs that don't touch the opioid route and the whole like reward system that's involved with addiction, etc. And rather instead, a lot of pharmaceutical companies and research academics are focusing on looking for treatments that focus on the periphery without intervening in the brain, so that we wouldn't have all those crazy side effects that we see with opioids, notably trying to aim at those gateway, get something kind of like CIP, insensitivity to pain, but not as far, just kind of like block it a little bit, like close the gate a little bit, but not too much. But unfortunately, so far, all of this is in development. Something that has worked decently for a lot of people with neuropathic, well, not a lot, but like some people with neuropathic pain are anti-epileptic drugs. So drugs that are normally used for epilepsy has been shown to work in some patients with neuropathic pain because it targets the same gateways, among other form of gateways. So like I talked about sodium channels, but there's also potassium channels, calcium channels. So there's electrons kind of like just wiggling around.
So the same
cells.
The same pathways that can stop seizures can also stop pain.
Yeah. So like the other problem that we have here is that these drugs lack what we say selectivity. So I mentioned that those channels, those gateways we have in the brain, we have in the heart, muscles, spinal cord, and those nerves. So and there's different subtypes, and so you have one subtype in the heart, a couple subtypes in the brain, a couple subtypes in the spinal cord. But the issue is that currently the drugs that we have that target those gateways, they target all of them. And so you don't want to be blocking the heart, for example. And so now we have side effect issues with those drugs closing all of the gates. And so we can have like problem with the heart, problem with the muscles, etc. So we are trying currently to kind of like tune it down so that it just like goes to the one subtypes that we're interested in. So get them more specific.
So if you could find a way to target these anti-epileptic drugs more, kind of give them more of a destination to go to by the doctor's choosing, then that could potentially be a replacement for prescription opioids like Vicodin, Oxycontin, things like that.
Like that would be the goal right now, is to try and find a drug that is only doing something to pain and not touching any other pathway. But that's very difficult because everything is intertwined, and those gateways, they're very similar. So it's difficult to find something that could attract the drug that is unique to this specific gateway involved in pain.